Hey everybody, Dr. Kent Hungerford here from Relieve Health Group again. Let's start looking at using Heidi in clinic, and I'm going to give you a little bit more of a introduction to the templates, how I go about a consult, and we're going to see that live today, and hopefully I don't make too much of a fool of myself, but let's see what we can do. Now, as always, if you haven't already jumped onto Heidi, do subscribe. Please, this will give you, your first month free, saving you $100, but it'll also give me about $10 or so, which I'd very much appreciate for putting all this together. But really, it's quite simple. What we're looking up here is we just want to be going through it, having a bit of a chat to our patients, and basically what I usually say is, I use AI technology to help with my notes, to write my letters, and are you happy for me to use that today? Now, 90% of people are going to say yes, or some of those, particularly if they're health practitioners, they'll say, oh, which one do you use? Now, rarely do people give me that look of like, oh, what's going on, or that they're asking for more information. But if they do either, if they give you a bit of a weird look, if there's a bit of that awkward pause, or they say no or want more information, I usually have my next lines ready, and I want you guys to be really comfortable with this because it's really important. And so basically, I just say the program that I use is called Heidi. It's an Australian company and it stores its data locally in line with our Australian strict privacy rules. They change what we talk about to text as we do it, and they don't record what we say. That transcript is then used to turn what we're saying into my notes or a letter, and it's deleted as soon as I want it to be. Would you like more information, or are you happy for us to go ahead and use it today? Now, most patients are going to say yes. I've only had 2 patients that have said no, and that's fine. We're here to give patients the information and education, but really the security is in line with what we're already using with our electronic health records. It's just that some people do get a little bit funny with regards to having their voices recorded potentially. But let's have a bit of a look now. We're going to start by hitting this recording button and see what mess we can get into. And I'm going to give you a little bit of a fake consult here as well. So we're going to change tabs. We're going to jump up to the Heidi platform, and this is live, okay? So we're going to hit start recording, and what you're seeing here is that time is going to start ticking away. Now, the thing that I love about Heidi the most is that we can have that family and friends conversation, how was your latest holiday, etc. But in the crux of it, let's jump into the consult, and I'm going to have a consult with myself and Tim. So let's start, and we're just going to have an initial consult here. So Tim, you've come in, you've got an ingrown toenail. Tell me a bit more about that. Oh yeah, it's my left big toe. I've had for maybe about 3 or 4 weeks. I think I cut down the sides, and sometimes I rip it out every 3 to 4 months, but it's been happening for on and off for about 2 to 3 years. Sometimes it bleeds a little bit, sometimes it doesn't. I've had antibiotics in the past as well. Okay Tim, that sounds pretty good. Can you tell me, have you, when you've had those antibiotics, have you had any reactions, or how bad has this been? Has the antibiotics always worked? Yeah, it has worked, and usually I have Keflex antibiotics. They're usually not a problem. I tolerate them fine. I've had no previous allergies. I'm pretty healthy, doc. I've got no problems that way. Now, okay, Tim, that sounds really good. What I'd like to do is have a bit of a look. Now, for us, off my script now, it's really important that we actually say our observations. And I commonly say, okay, Tim, just for our AI, I'm actually going to talk to Heidi for a moment to let her know what I'm looking at. Basically, my observations are that you have a right first medial ingrown toenail. This nail's quite involuted. There is no thickening of the nail. There is no discoloration to the nail. There is a little bit of localized edema and erythema, although it's not extending past the proximal nail plate. There is pain on palpation. There is no evidence of pus or serous exudate at this stage. The sulci appears to be dry. There is palpable dorsalis pedis and posterior tibial arteries to both feet, and there is hair on the foot. Now, Tim, I really appreciate having a bit of a look at this. I can see that this does look like an ingrown toenail, and I think it's mildly infected. And at this stage, what I'd like to do is excise that nail side and trim your nails so that we can prevent that from causing you pain. You know, there's a small risk that I might cause some bleeding, might be a little bit tender or painful, but I don't think we need to use a local anaesthetic at this stage. Now, the other option you have is a minor procedure that we can do in rooms, and basically what we do there is we stop the nail from growing back. Do you want me to talk to you a bit more about that? Oh no, doc, let's just do the conservative. I've got to get back to work pretty quickly, so let's do this today if you think that's going to help. Okay, let's do that, and you know, I'm just going to let Heidi know that, you know, what I'm going to do is I'm going to remove that nail, I'm going to clean it with saline, I'm putting an island dressing on or a band-aid, and then we're going to be clean. Now, Tim, what I want you to be aware of is just signs of infection. That's red, hot, swelling, increasing pain, and if that happens, I want you to come back and see me or your GP, and we'll look at some antibiotics. Do you understand everything that I'm talking about? Yeah, that's no problems, doc, thanks. Beautiful, let's do that. Thanks, Tim. We'll see you in you know, a week's time just to make sure everything's settled down. But if there's problems beforehand, please come back and see me, okay? So again, that's the red, hot, swelling, pain. That's when I want to see you. Beautiful. Okay, so Tim's finished now. Tim's left. We can stop the recording, and straight away what we're going to see is that the interpreting patient dialogues. And you know, I'm interested to see how this comes up because I've been acting as the patient and the practitioner, but it should come up pretty well. And very commonly what I do is once the patients leave my room, I'll give it a little bit more context, I'll give a bit more information about the observations or insights that I didn't want to say during the consult, and that's totally fine. What I do want to see is that this has now come up quite nicely, and we're going to scroll down a little bit and see that there's quite a bit of information there, and this is in a really nice template already. Now, what we want to do then is we're going to go up to create document. For me, I want to look at this as an initial patient. I want to know all the details. So I'm going to go into that initial podiatric assessment for me. And what that's going to do is straight away put it into one of my pre-templates that basically goes through here. Now, it's not coming up perfectly just yet because it's not completely done, but you can see that it's starting to load as we're going. And that's fine, you know, non-smoker and a lot more of these sort of things I'm going to pull out as we're going. It's got all of these additional notes. And for me, that care plan rationale is really important as well. And so for me, yep, you know, here we're doing conservative care. It's sort of you know, reasonably happen. The patient understands the need to monitor for signs of infection, and the importance of follow-up as well is quite important. Now, I'm really big in making sure that our patients and practitioners are all kept in the loop. So I'm going to come back to that created document again. I'm going to go to my GP or referral letter. And then I've got a template for this one as well, and that's going to make sure that, okay, we've got our impression, we've got our plan, the GP's aware of anything there, and you know, a lot of the time I'm going to edit this and basically say, you know, be aware that he may come to you for antibiotics. But basic information there, the provisional diagnosis, what we discussed in any education, when I'm going to be following up, and for me, I'm done with Tim. I can copy paste those into my notes, and I'm really happy. You know, we're going to go through a little bit more on these templates in the next session, but I think that really covers off everything that we need to do for the moment. But hopefully that gives you a bit of an insight of, you know, looking at these templates, really accessing, you know, how Heidi actually works. And I think this has been a really great example of how it works. So if we go back to that initial podiatric assessment, we can really start to go through and edit anything we need to, or write back to that note. And I say, oh, I totally forgot. Let's go resume. And let's say, you know, I noticed Tim also had ingrown toenail of his left side, not just his right side. There was an involution there. We did talk when we were in the next room about potentially undertaking a partial nail avulsion and matrix ventilation. I also forgot to say to Heidi that I gave him an information sheet on a partial nail avulsion. Now, if we stop that recording there, that's now going to be put back into the notes, and we can then refresh each one, and it's going to be put in there a little bit more so that we've got that detail that we might need. Now, I can see this bar slowly getting bigger, so I know my notes are nearly done, but we're going to go all the way down to the bottom of this one, and I'm going to be looking for it. Where are we? Information sheet on partial nail avulsion provided. Perfect. My notes are accurate. I'm really happy to see that. And we've talked about the procedure, but we've gone ahead with the conservative. The patient's aware of the risks, the recovery, and we're going to be covering that off, as I know you would, in a lot more depth than my 3-minute and 56 consultation here. But very much, I think we're very well covered there. Hopefully that gives you a bit more of an insight of how Heidi AI works. Cheers.